All right, let's get into it. We're going to tackle something that, can cause a little bit of anxiety. Finding a weird, mysterious spot on your skin. We're going to demystify what that lesion could be and probably more importantly, how to work your way through the healthcare system to get some real, confident answers.
I mean, who hasn't had this moment, right? You see something new, and there's that little flicker of worry, that feeling of, what do I do now? It's super common, and it's the start of what we're going to call the symptom-to-system journey, and we're going to walk through it together.
So, you've found a spot. The first thing to know is that most of the time, it's going to be totally harmless. But what does harmless or benign really mean? Because when you start talking to doctors, and especially insurance companies, those words have some very specific meanings. And this is really where your personal health meets the, let's say, practical side of things. A document from an insurer, like this one from Blue Cross Blue Shield, isn't just a bunch of boring paperwork. It's basically the rulebook that decides whether getting that spot removed is covered and who's going to pay for it. And here it is, the core definition straight from that rulebook. A benign lesion is just a non-cancerous growth. So here's the bottom line. If you want it gone just because you don't like how it looks, that's usually considered cosmetic, not medically necessary. But that word unless, that is the key.
So how do you know if you fall into that unless category? Well, this is where we can take that dense insurance policy and turn it into something you can actually use, a personal checklist. This is how you go from just worrying about it to taking some real, informed action.
And here it is. This is literally the checklist of red flags that your doctor and your insurance company are looking for. You've got the obvious one, of course, if there's any suspicion of cancer. But look at the others. Is it painful? Is it bleeding? Does it get caught on your clothes or jewelry all the time? That actually counts as recurrent trauma. This list is your best friend for having a productive conversation with your doctor.
Okay, so when you find a spot, it's not just a simple choice between it's fine and it's cancer. It's a little more complicated than that. To really get the full picture, we need to understand a few other common categories that a skin lesion might fall into.
This chart does a great job of breaking it down. First, you have your benign growths, totally harmless unless they start getting irritated. Then there's the premalignant category. These aren't cancer yet, but they have the potential to turn into it down the line. And finally, some spots are actually a sign of a sexually transmitted infection, or an STI. Understanding these three buckets is really the key to a diagnosis.
Let's drill down on that premalignant category for a second. This quote is about something called vulvar intraepithelial neoplasia, or VIN. It's often linked to the strains of HPV that can cause cancer. And what the American College of Obstetricians and Gynecologists is saying here is super important. Even if it might go away on its own, the risk is serious enough that it should always be treated as a precancerous condition.
Now let's look at that third category, STIs. Genital herpes, which comes from the herpes simplex virus, or HSV, is a perfect example. The thing is, it can first show up as tiny blisters or sores that are really easy to mistake for something else, like a pimple or an ingrown hair, which is exactly why getting a proper diagnosis from a doctor is so crucial.
And just to give you a sense of how incredibly common this virus is, look at this number. According to the World Health Organization, 3.8 billion, that's billion with a B, people under 50 worldwide have HSV-1. That's one of the viruses that causes genital herpes. We're talking about roughly half the planet's population in that age range.
Now, the point of a number that huge isn't to scare you, it's to do the exact opposite. It's to normalize this conversation. So many people have the virus and have no idea because they never get symptoms. Understanding this helps remove the stigma and really drives home why you can't make assumptions. You have to get checked.
All right, so now you get the possibilities, you know what to look for. The next big question is, who do you actually talk to about this? Putting together the right medical team is the next critical step on this journey.
This comparison really lays out your options clearly. Think of your general practitioner, your GP, as your home base. They know you, they know your history, and they are the perfect first person to see. But they do have limits. They usually can't do a biopsy and might not have seen a ton of complex cases. A specialist, on the other hand, like a dermatologist or a gynecologist, has that deep expertise. They can do all the advanced tests, but it can be a lot harder and take longer to get an appointment.
So, when is it time to push for that specialist referral? Here's your cheat sheet. If you've been trying a treatment from your GP for 3 months and nothing's getting better, it's time. If the diagnosis just isn't clear, or if you definitely need a biopsy, it's time. And honestly, this last one is so important. If you feel like you're not being heard or your care just feels stuck in place, that is your cue to advocate for yourself and ask to see a specialist.
Okay, let's zoom out for a minute. This whole personal journey we've been talking about, it isn't just happening in a bubble. It's all playing out against a backdrop of some pretty major public health trends, which shows why being an informed, proactive patient is more important now than ever before.
And this chart shows one of those trends perfectly. According to the American College of Obstetricians and Gynecologists, cases of VIN, that premalignant condition we talked about, increased more than 4 times over in the U.S. in less than 30 years. This is not a static problem. The whole landscape is actively changing.
And here's another number to put the scale of all this into perspective. The Journal of Urgent Care Medicine reports that in a single recent year, there were about 2.4 million combined cases of chlamydia, gonorrhea, and syphilis reported in the U.S. And remember, that's only the cases that actually get reported.
So when you put all this together, rising rates of STIs and other conditions mean way more people are out there looking for answers, and it's changing how healthcare works. Places like urgent care centers are increasingly on the front lines, becoming that first crucial stop for diagnosis for millions of people.
So, we started with something small and personal, a single spot on your skin, and we've seen how having the right information can empower you to take control. And it kind of leaves us with one final thought, a question for you. What's the one conversation about your health that you've been putting off? And what's the first small step you can take to start it?